Hello, Lambert University family. My name is Dr. Tanya Lambert, your fibroid wellness coach and women's health educator. On my channel, I provide women with fibroids and their families with high quality information from a natural and a medical perspective to help you get relief so you can be on your healing journey from fibroids. Now, in this video, I'm going to share with you my experience with the uterine fibroid embolization procedure, also known as the UFE. In my previous video, I shared with you that was one of the medical procedures that I actually did to get relief from fibroids. Now, some of you may be thinking, well, Dr. Lambert, I thought that you were into more of a natural approach to dealing with fibroids. And I want to let you know that yes, I am. However, I have to share with you the reason why I got that procedure and why it can be a useful procedure if you are considering a medical procedure to deal with heavy bleeding due to uterine fibroids. But before I get into this video, I would like to share my disclaimer with you. Now, before we get into this exciting topic, I would like to share my disclaimer with you. All of the information that I provide in my videos are strictly educational and informational. None of the information that I provide should be used to substitute medical advice. If you have any questions pertaining to your own personal health care needs or prescriptions or medications, please see your licensed medical provider. All right, let's get into this exciting topic. So in my recent YouTube video, which I posted on June 5th, I shared with you all that I took 98 birth control pills in a span of 10 days to deal with persistent vaginal bleeding due to uterine fibroids. Now, that method was prescribed to me by my physician at the time because it was the standard of care for women in my situation. Unfortunately, after taking that many birth control pills, also along with other hormonal therapies at the time, that contributed to the prolapse of one of the fibroid tumors from my uterus into my vagina, causing it to hang by a stalk. If you want to get the full story on how that all happened, I encourage you to go back to the video I posted on June 5th, 2023 to hear the entire story. After this experience, I got a second opinion from another OBGYN who referred me to an interventional radiologist who actually performs the uterine fibroid embolization procedure, which I'm actually going to refer to as UFE for the remainder of this video. Now, for 2 years before my tragic experience of that prolapsed fibroid, I heard about the UFE procedure, but I did not know whether or not I was a candidate for it. Now, while I was considering the UFE procedure, I was finishing up my surgical rotations in medical school. And I have to let you know, the surgical rotations are very stressful. So even though I was fully plant-based, just the additional chronic stress of going through that type of rotation did not really help me much on my healing journey. So as a result, I ended up having to consider that procedure to deal with the heavy bleeding due to the fibroids. Now, when I went to see the interventional radiologist, I learned a lot of valuable information that I would like to share with you if this is a path that you are considering on your journey to getting relief from fibroids. Now, I'm going to be sharing 8 points of information about the UFE that I think you will find very valuable. First, I will be discussing what is the UFE procedure. Second, I will be sharing with you who typically makes a good candidate for the UFE procedure. Third, I'll be sharing with you the benefits of the UFE procedure, as well as the cons and potential side effects of the UFE procedure. And finally, I will share with you whether or not the fibroid tumors can grow back after the UFE procedure. First, what is the uterine fibroid embolization, also known as the UFE procedure? The uterine fibroid embolization, or UFE, is performed by a licensed medical doctor known as an interventional radiologist. It is a minimally invasive procedure, meaning that they don't cut on your abdomen or your uterus. What the physician does is that he or she will make a small incision in your wrist or your upper thigh and then insert a catheter that is guided by fluoroscopy or X-ray into the uterine artery. Beads are then going to be inserted into the uterine artery to block off the blood supply to the uterine fibroids. When the blood supply is cut off to the uterine fibroids, that prevents them from receiving any nourishment and causes the cells of the fibroids to die, and then the fibroids can shrink. The success rate of the UFE procedure is approximately 85% and could be a little higher depending on the skill of the interventional radiologist that you are seeing. Who makes a good candidate for the UFE procedure? Now, first and foremost, I want you to know that I can't tell you whether or not you would be a good candidate for the procedure. You would have to speak with your licensed physician to help you to determine that. But in general, women that have heavy bleeding due to uterine fibroids tend to do well with the procedure as it helps to reduce or even stop the heavy flow. Personally, for me, the UFE procedure helped stop the heavy flow within the first month of me taking the procedure. So in that regard, it was successful for me. Second, women with very large fibroids, even those that are beyond 10 centimeters, tend to do well with the UFE procedure. And third, women with calcified fibroids tend to do well with the procedure too. But again, speak with your licensed interventional radiologist to determine if you would be a good candidate for this type of procedure. What are the benefits of the uterine fibroid embolization? 1, it is minimally invasive. So the beauty of the uterine fibroid embolization, or UFE, is that they don't cut on your uterus. So for one, you will have a faster recovery time. Most women are nearly fully recovered within 2 weeks. Personally, for myself, after 2 weeks, I was up and running, but I took about a full month off from my clinical rotations in order to properly heal. And after 2 weeks, I was studying, I was getting prepared to go back into my clinical rotations, so it was very convenient. Also, the fact that the doctor does not cut on your uterus helps to preserve your ability to have a natural birth. Because with a myomectomy, in which the OBGYN would surgically cut out the fibroid tumors, that can result in the formation of scar tissue in the uterus. And scar tissue is typically weaker than the natural muscular tissue of the uterus, so that if you want to have a natural birth after conceiving, that can increase your risk of having a rupture of the uterus after a myomectomy. But of course, speak with your licensed physician to determine which of the two procedures would be best for you if that's what you're considering doing. So ultimately, the UFE procedure has a quicker recovery time, and if fertility or pregnancy is your goal, it does help you to preserve the option of having a natural birth. Now, some of you are wondering if the UFE procedure can prevent you from becoming pregnant. In general, no, provided that you find the right interventional radiologist to do the procedure for you. If the procedure is done correctly, it only cuts off the blood supply to the fibroid and not to the uterine lining. So you will still be able to have a menstrual cycle after having the procedure. And many women are usually able to conceive a child 3 months after the procedure. Some women may even want to wait a year, depending on their situation. So it is very important that you look at the testimonials of the physician that does this procedure to see if women are actually becoming pregnant after the procedure is done. So just a few tips on how to select a qualified physician, or I should say to select a physician with a high success rate. The main thing is you want to look at their testimonials on their website. You also want to speak with them and ask them if their patients do become pregnant after having the procedure, and also if women actually do go into early menopause after their procedure, because some clinicians would be able to tell you that typically no, it depends on how properly embolized they actually are. Now, in my case, I actually saw an interventional radiologist by the name of Dr. John C. Lipman. I am not being endorsed in any way by his practice. His practice is called Atlanta Fibroid Center. Personally, for me, it was the best decision I made to actually see him for the procedure because it was incredibly successful afterwards. Now, I will share with you more of my journey on how that procedure worked for me, but in terms of reducing the heavy bleeding, it was successful. So what are the cons of the UFE procedure? So the issue with the UFE procedure is that it does not address the root cause of why you developed fibroids in the first place. So it's very important that you assess that, whether it's through hormonal testing or looking at your lifestyle to see if there's anything that you can change to prevent the fibroids from growing back. Now, in some rare cases, the UFE can cause early menopause. Now, in that case, that could be that one of the beads accidentally blocked the blood supply to the ovary, resulting in premature ovarian failure. But that is very rare and not likely to occur, provided that you're actually working with a highly qualified physician to do the procedure. Now, are there any potential side effects? Typically, there aren't many side effects of the UFE aside from pain at the incision site and some cramping. However, most women tend to be up and running again, living their normal day-to-day lives after 2 weeks of doing the procedure. But I encourage you to speak with your physician to see if there are any other side effects that you should be concerned about. And finally, do the fibroids grow back after the uterine fibroid embolization? Now, just in general, the UFE procedure typically deals with the symptoms of the fibroids and it does help to shrink them. However, if the underlying cause of the fibroids are not addressed, then yes, they can grow back. So what I do encourage any woman who is considering this procedure to do is that before you even do any procedure, you really want to take an inventory of your lifestyle. What are the foods that you're eating? Are you managing your stress properly? Do you have diabetes or insulin resistance? Are you struggling with obesity? Do you wear products like body products that have xenoestrogens or man-made estrogens in them that contribute to estrogen dominance? Because the issue with fibroids is that it is more of a lifestyle disease. And you have to ascertain what is the root cause for you before you can make any solid decisions or lifestyle changes that can help you to not only heal from them naturally, but shrink them quickly if you decide to do the UFE and even prevent them from growing back. Because health is actually a lifestyle choice. And it's very important that you take a non-judgmental look at your lifestyle, not beating yourself up about the choices that you made that weren't as helpful to you, but figuring out what you can do better after the procedure so that you can heal quickly. That was something that I did before going into the procedure. I was eating a 100% plant-based diet. However, my stress levels were high due to the fact that I was on my clinical rotation. So I was doing my surgical rotation at the time. So after that, I made sure I took a month off after the procedure to unwind, and then I had to adjust my schedule appropriately so that I was able to not be under as much stress as I was previously. And that resulted in a more rapid shrinkage of the fibroid tumors to the point that when I went back to the doctor, he was shocked and amazed to see that I was 60% ahead of the curve of most women who typically do the procedure. So I do want to add that after the UFE procedure, my menstrual periods went from being nearly every single day. So I went from bleeding almost every single day to having a menstrual period that lasted 4 days out of the week. And I ended up only using 2 to 3 sanitary napkins per day, which was great. But there was a drawback. I noticed that even up to 2 years after the procedure, my period would come every 2 weeks, which wasn't normal for me. I spoke to the interventional radiologist about that, and it turns out that that wasn't a side effect of the procedure. However, it did indicate that I still had a hormonal imbalance that wasn't properly taken care of. So I was able to use a combination of herbs, which helped me to normalize my menstrual cycles. So instead of it being 14 days in length, it is now 24 days in length. And my menstrual period, which is not the same as the cycle, the bleeding time is still 4 days out of the week. And I just had to say, hallelujah, thank you, Jesus, because now I have normal menstrual cycles and my menstrual period is only 4 days out of the week when it comes every 24 days. And I don't use more than 2 to 3 pads daily. And by day 4, I'm pretty much done. So that's my journey with the UFE procedure. So sis, you have the power in your hands to heal from fibroids, but it's a matter of making sure that you take the right method or path for you, and also that you put the right lifestyle habits into place, which is what I help women to do. Now, in my next video, I'm going to share with you all exactly what I did after the UFE procedure to rapidly shrink the fibroid tumors. If you like the content in this video, I want you to give it a thumbs up, share it with your friends, subscribe to the channel, and don't forget to hit that bell so you can get the notifications on when my next video will be. All right, take care of yourselves and God bless.